Lens Africa Television, the mirror of the continent.
So, thank you, Mr. Michael, for the wonderful work you're doing. At this point, we would like to find out, does anybody have any question?
Yes, so if you have a question, raise your hand. The moderator has opened the floor. We'll just take one. Please raise your hand if there's any. If there isn't, we'll go straight to the interventionist. Mr. Moderator, it's back to you.
It's okay.
The interventionist.
Okay, that was a very wonderful one. Globally, there are about 29 million disabilities in Nigeria, or in Nigeria rather. It means that the number is increasing. And I heard that you have like 4-bedroom apartment?
Yes.
How you
4 children.
For how many children?
17 children.
17 children.
Yeah.
How is that well spaced, and how, because they need a lot of aids to be able to manage this development. So how are you doing that?
That is one of the issues we have, and that's why we're here. The space is not enough. That's why we need to expand.
Okay.
Yeah.
And how have you been recruiting these people? How do you bring them into your organization?
Okay, so we work with different organizations, including Social Development Board. We have a child currently who was referred by Social Development Board. We also have children that we've rescued. We have a story of a child called Teso. Teso was declared for dead. He was asked to be killed before we rescued him. As we speak, this is school of the deaf in Kuje. We rescued him. He's in our center, and so many other children like that. So there are times we get referred by government agencies. There are times we get referred by other people like you, and then Nigerians in diaspora, and so many other organizations.
So we take the next interventionist.
Thank you.
We have Mrs. Doyo Bong Etim.
Okay, can I say something?
Yes. Sure, sir.
My name is Otumbali Kwewila. I am the Managing Director, CEO of Ultimate SHMO. I think it's important for us to begin to expand our requests for investment at this kind of platform. For instance, I want to highlight the fact that with what you're doing, all you needed to do first of all is to try and reach out to the National Health Insurance Authority and seek for possibly the accreditation of your facility, no matter how small it might be. Because the moment you succeed in achieving that, that could lead to the enlistment of your facility on the network of facilities that will provide services such as you do for Nigerian children, okay? And that could drive systematic flow of enrollees or patients to your facility.
You have 3 minutes. Your time is already counting.
Please go straight to the point.
Good day, ladies and gentlemen. I prepared a speech here. My name is Dr. Umfon Ntar, and I stand before you today not just to present a company, but to share a vision. A vision that intertwines the rich heritage of African medicine with cutting-edge technology. We believe that healthcare should be immensely beneficial to everyone in the health pipeline, from us, the patients, to the healthcare provider, to the research scientists, to the technology builders, and to the system. Imagine a world where your medical intervention is not based on generic data, but on understanding the life of your family, the conditions they have overcome, and the strengths they have cultivated. I say all this to mean that it can be done, and the only way that future exists is the one we create. Thank you.
Thank you very much.
Yes, really, artificial intelligence is a big deal in medicine right now. How are you, it's just because there are a lot of potential investors here. And just to make sure that when it comes to healthcare, we do not joke with data in the formation of people, right? How are you making sure that this information is going to the proper channel without any litigation?
So even if there is an AI model that exists, if we build on top of it, it does not contain our data. That's what our research showed. So if we need to build artificial intelligence models for Nigeria, for Africa, we need to gather that data by ourselves. And gathering this data needs specialized eyes. It needs specialized people who are familiar with the healthcare industry. I am an artificial intelligence engineer, and I have met other artificial intelligence engineers. that are building specifically for healthcare. So these are the team of people I'm working with. Join us to bring the Healthcare Center to reality, to add the value of comfort and community for children with disabilities and their families. We simply cannot do this without your help. Join us in changing the narrative of disability so that all children, regardless of their ability and socioeconomic status, can thrive. Time is very limited for me to go further into detail about the work Healthcare Children's Foundation has done. I invite you all to visit our website at healthcarecf.org, or if you have time today, a one-on-one with me. But for now, thank you for listening, and I welcome any questions that you may have.
Thank you, Mr. Moderator.
Thank you, Fatima Bello of Healthcare Children.
Keep doing the community outreaches to be able to increase that visibility. I also have an NGO, and I know what the impact of community outreaches means, because through that, support actually came in. So keep doing that.
Thank you. Thank you very much. Health is wealth. And according to WHO, health is not just the absence of disease or infirmity, because health has different aspects to it. And in this aspect of the health for the patients, I just want you guys to look beyond the investors. There is more to healthcare. There are more things to be done. And in healthcare, the uniqueness around it is more of partnership, collaboration, and openness. So be prepared, be mentally prepared, change the paradigm. So while we are waiting for the bigger fish, meaning the investors, let's keep going, let's keep doing something, just because health cannot afford to wait. Thank you so much.
Health cannot afford to wait. It's over to the moderator to conclude the session now.
Thank you very much, our investors, audience, and every other person that participated in this session. We want to thank the MC for making it a seamless event. Thank you very much.
Thank you. We'll now take a group photograph. We call on Mrs. Badewa Adejugbe Williams, Dr. Ms. Badewa Adejugbe Williams, to join for photograph. Mining and energy. You can celebrate Democrats, you can celebrate Republicans, depending on how you feel. Celebration is celebration.